Hi, I'm Paul Smith. I'm the Acting Director for Adults and Communities for Herefordshire Council, and I'm here with you today to talk to you about the Integrated Care System, often abbreviated to the ICS. The ICS is a response to some new NHS legislation which will bring together the health and social care system in Herefordshire to the benefit of patients, citizens and residents, and will improve the working relationship between statutory bodies and the voluntary sector, hopefully for the good of better outcomes for individuals who live within Herefordshire.
And quite frequently, the things that patients are very concerned about and write and complain about is where there's been gaps in care. There's been problems between the different sectors, whether that's between the GP and the hospital consultant, or whether that's between the district nurse and the social worker. It's those gaps that cause most of the problems. So this is an opportunity to really listen to the experience of patients and try and put some of those things right.
ICS is all about joining up care, and you could argue that we should have been doing that for years. And we have been trying to do that for years, but this is giving us the legislation, I think, to support a different way of working.
So what does that mean? It really means that each partner in that care knows what's happening to you, knows your story. It means that you don't have to repeat your story again and again to everybody who you come across, and that we coordinate your care so that we're not duplicating things. So you've got one person coming in the morning perhaps into your home and somebody else coming in the afternoon. Can we coordinate that so it all happens at the same time, or that individual that comes can actually do the work of both people, so that all of that means that it's less duplication and it's much better value, as well as a better experience for our patients and for our citizens.
Herefordshire and Worcestershire is one of the smaller integrated care systems, but what that does, that makes it even more important that we work together. We have limited resources. Whenever they do funding formulas that work out how much funding we get, we're usually towards the bottom of that league table, mainly because when they assess overall health and care need, the health and care needs of our population are a bit lower than those that live in inner city urban areas, and that's partly because large parts of our two counties have a fantastic quality of life and have really good health outcomes, which is a really good endorsement of the current health and care offer. That low resource base, though, does make working together really, really important. We will not be able to survive and prosper without that collaboration across our organisations.
For us as a mental health provider, this is an opportunity to make sure that mental health is at the heart of all health and care delivery. We know that long-term mental health problems are often associated with poorer physical health. So often people with long-term mental health problems have challenges with diabetes, heart disease, and other long-term physical health conditions. We also know that having a long-term physical health problem increases your risk of developing mental health problems like depression and anxiety. Mental health is also linked to housing, employment, loneliness and a sense of community. We want to work closer with local authority and third sector partners to ensure that we're joining all these elements together for the good of people's mental health.
From an adults and communities perspective, I think that the ICS presents a once-in-a-generation opportunity. The integration and closer working relationship between NHS partners and local authorities has long been discussed. This presents the opportunity for that to become a reality, and I strongly believe that outcomes for residents, citizens will be improved.
I think staff can get very frustrated with the lack of joined up care for patients, and so for staff working in Herefordshire it should also be a much better working life, because things should be less frustrating than they currently are. An example of that might be the way that we share information between the different partners who are involved, and really importantly how we share information with patients and their families themselves.
Very simply, the clinical commissioning group won't exist, and the integrated care board will take on all of the responsibilities that the CCG has had, all of the staff, and the balance sheet and the buildings and everything else. So my organisation will be probably one that's more affected than most, certainly in the short term, because all of the staff, their employment and their contracts will transition to the new organisation.
It allows us to think about one budget, one approach to both workforce and how we make those changes, and actually we'll have to both challenge each other and support each other. And I think we've already seen that during the whole COVID response and COVID vaccination, and I have to say I'm very positive about the changes.
In the NHS for quite some time, we've been working in a semi or quasi-competitive market. What the changes really mean is that isn't going to be the case anymore. So the things that people want to do, so staff come to work every day, they want to make a difference, they want to do a really good job. And so to not feel like they're in competition with either other hospitals or with primary care or with anyone else, so that they feel like they're generally working together, that's just a much better experience, and it should be again really better value for the public sector pound than the old competitive market way was.
I think we have been through a period where we focused a lot on trying to drive value through procurement and transacting and specifying. We're now very much in an era where it's about collaboration and working together and people joining stuff up. It definitely needs to be done, because I think everybody would agree we probably face more challenges in looking after people's health and care than at any point really in our history as a country. We're coming off the back of a pandemic. We already had the demographic profile of the community was changing. People were living longer, which is great. But obviously in terms of health and care services, we have to adapt what we offer in order to look after people who are living longer.
I'm incredibly pleased when attending ICS programme and board meetings that representatives from the VCS sector are highly visible within the ICS. They have a seat at the table and voting rights alongside the statutory partners, and I believe strongly that Herefordshire already has a very robust, creative and committed voluntary sector, but the ICS will create the opportunity for it to become more visible, more accountable and more involved within strategies, policies and services and support for citizens within the county, because of course nobody knows the county better than our voluntary agencies.
Community and voluntary organisations are at the heart of the community and at the very centre of what we're trying to do. We work together closely with Herefordshire Mind to ensure that whatever level somebody's mental health need is at, we've got a solution that's going to help address that.
I think the voluntary and community sector have got an enormous role to play, a critically important one. I don't think that the statutory agencies have been as good of adapting how we work to try and get the most out of the amazing voluntary sector organisations that we have in Herefordshire. I really hope that they can play a key role. One of the things that will make this a lot easier, I hope, is the much greater focus at neighbourhood level. So I know that voluntary organisations usually work on a very local basis. We don't have as many that cover the whole of Herefordshire, but we have a lot of really good local voluntary infrastructure around our villages and towns. What will happen is a lot of service delivery will be coordinated through the primary care network, so your GP practice working with neighbouring GP practices. What the hope is that will allow the voluntary and community sector a much easier way in to align their service offer, the support and the help that they can offer people, to align that with the more formal NHS and social care services that are available.
If I think about some of the examples that we've done, we can set up a hub in Kington as an example, but if you've got no transport from Leominster, then what's the point in that? So actually we need to link things together. Mental health services need to be looked at, but you can't separate mental health from actually what's going on with perhaps things at home and the other services that they may need to support them, which may link around finances and lots of other things that we're all involved in. So I think that's the key thing. It isn't thinking about health and social care in a pocket on its own. It's actually thinking about how we actually work to solve the problem that our communities need. And actually to do that, we need communities to tell us how we do that.
By establishing the Herefordshire Community Partnership, that is a way for us to work with Healthwatch and again with other partners so that we can engage with the community, engage with our population, the people who live in Herefordshire, in a much more meaningful way.
I recognise that there are multiple groups at the moment in terms of participation. So we have general practice, PPGs, there is a voice at parish council, there'll be mental health support groups and various other initiatives that are going across the system, as well as a multitude of activities across the voluntary sector. And I think it's important that we kind of try and bring some of this together, and ideally working in local geographies where possible, to think about how we work in these networks which are there to facilitate those local conversations. And I'm hoping that the community partnership and voluntary sector can have quite a powerful voice in those areas, which will then also feed up the tree. And I think the community partnership is a way of trying to coordinate that voice.
I mean, the public's voice is really, really important. That's something we've taken really, really seriously. Herefordshire Healthwatch have been a much valued and really important partner. They play a huge role in the work that we do, because ultimately people in jobs like mine, you understand I'm here to serve the public, I'm here to serve the taxpayers and the patients of Herefordshire. What the patient voice can do is to make sure that we really understand, and the people that are designing services and planning services and operating services, they really understand what people want and need.
I mean, this isn't new. We've had ways of listening to the public before, but what we've always done before, we've done that individually. So the CCG has had a forum, the White Valley Trust has had a forum, the local authority has a number of forums. GP practices have forums, so we listen to the public in lots of different ways, but what we don't really do is listen to them all together. So not only are we going to be leading and managing the services that we provide to the public together in a real partnership way, we're going to be listening to the public together as well in a partnership way, and that's quite an opportunity to make a difference.
What we've often, I don't think, not done really effectively is involve them right from the word go. And I think that particularly is the case also with clinicians. If we involve the frontline teams from the word go, they will own it and they will get involved. And I think the same goes for communities and voluntary services.
We have an active Making It Real board within Herefordshire that plays an active part in design of all services that we commission. And as part of the commitment to the voluntary sector within the ICS, we are working with Healthwatch to ensure that the VCS is represented, and of course that the voice of the patient and the resident comes through very strongly in service design and co-production.
How do we pick up the voice of those who cannot be heard as well as others? How do we pick up the inequalities? How do we ensure that there is a diversity in all the voices that we're hearing? And I think one thing we've done really well during the vaccination programme is the voluntary sector has been hugely supportive. It couldn't have been delivered without the voluntary sector. It's been massive. But we've had challenge with regards to how do we deliver that same programme to the farming community, to those who perhaps haven't got access to some of the IT systems that we need them to have, haven't got access to transport that they might need, or actually can't get out of the house to get their vaccination because they're busy caring. And I think all of these things really are really crucial to get right, and how we bring this together is going to be really important to ensure that we've got the voice of all. And I'd like to encourage the community partnership to really consider that and think about how we kind of ensure that that voice comes right from the front line all the way through the system, because I think that's the likelihood that's going to give us the biggest change of the services that we need to see delivered.